The next topic is about chronic cough. And again, in your mind, say, why are we talking about chronic cough? It's nothing that's very clinically important. And as Tom mentioned, my initial passion when I started pulmonary was cancer. I was into lung diagnosis, bronchoscopy, procedure, interventional bronchoscopy. So that was really what I wanted to do. Over the years, I started dealing more and more with patients with chronic cough. And it's very interesting that as we evolve, now we have a cough clinic, we have patients that come from all over the country to visit, because what happens with patients with chronic cough, cough of course is a very common symptom. Again, no disclosures. We're going to try to learn about cough, try to define how to investigate chronic cough, and understand what therapeutic options we have for them. So the definition of chronic cough is varies, there's multiple definitions, but overall, people tend to agree that cough that lasts more than 3 to 8 weeks is considered a chronic cough. As I mentioned, cough is probably the most common symptom in outpatient practice. Cough comes, goes away, or physician sees the patient, treats for one very obvious cause. But the trouble is when the cough doesn't go away, the patients start seeing different specialties. They go see pulmonary, they see ear, nose, and throat, allergy, and they go on this merry-go-round, and everybody's trying to help, and they keep adding medications. So the patients sometimes come with 10, 15 medications, and really don't know the etiology of the cough. So it's very important to kind of try to identify the most common cause of chronic cough and what to do about it, and if those are not met, what else should we do? Remember, cough receptors, they're not placed only in the airways. We have cough receptors in the sinus areas, we have cough receptors in the esophagus, we have even cough receptors in the pleura, the diaphragm. So it's a very multiple sites of cough receptors. And of course, the effector brace is through expiratory muscles, diaphragm, and larynx. 99% of patients that don't smoke and have a normal chest X-ray will have one of these 3 elements. So this is, again, the main message for today. You see somebody with chronic cough, non-smoker, normal X-ray, look for these 3. Of course, if one is obvious, you treat that obvious one. But if that doesn't resolve the cough, that's when you go and investigate the other 2. So upper airway cough syndrome could be chronic sinusitis, it could be postnasal drainage, is the most common cause of chronic cough. Second one is hyperreactive airway disease. Asthma is one of these elements, but we're going to see there are several other ones.